Welcome to Nami Live, your mental health community. I'm Susan Racher, volunteer board chair of Nami Miami-Dade, the Miami-Dade affiliate of the National Alliance on Mental Illness, the largest mental health peer-to-peer organization in the country. We're absolutely committed to educating our community and to combating stigma, which is why we have this program. The intention of this program at NAMI Live is to provide you with understanding of resources in our community for mental health, as well as to help you understand that it's okay to ask for help, that during our lifetimes, we all will have a mental health challenge, and there is no reason to have shame or stigma. Before I get started with the program, I just wanted to shout out a big thank you to the community, to Miami-Dade County, our mayor, our commissioners, our police departments, our fire rescue and fire departments, our sponsors, and the more than 3,000 people and 200 teams that joined us on May 20th at Marlins Stadium. We absolutely achieved our goal of making sure that all of the people in attendance in our community understood the landscape, the resources that mental health organizations offer in our community, and we had an absolutely amazing time. Stay tuned for May 2024, and we will announce the date of our next walk. But it was a rousing success. I also would like to thank Community News for helping us to advertise and get the word out on the walk. Today, we will introduce a very important partner both to NAMI Miami and to our community, Mount Sinai Medical Center, who is also a sponsor at the walk. Mount Sinai has both an inpatient and an outpatient behavioral health unit, and it's absolutely full of resources, programs, and services that we will share with you today. Also, we will talk about warning signs, when you need to get help, what are some protective factors as we do a deeper dive into mental health and aging. Joining us today are two amazing guests, Dr. Melissa Verzura and Giselle Alvarez. Dr. Verzura is a psychiatrist at Mount Sinai Medical Center, both in the main medical center as well as the Wien Center for Alzheimer's disease and memory disorders. She has a practice of adult and geriatric patients and also teaches medical residents and helps mentor the next generation of psychiatrists. Giselle Alvarez is the administrator for the behavioral health unit at Mount Sinai Hospital. And welcome, we're so thrilled to have you in the program and to understand more about Mount Sinai's community resources and dedication. Mount Sinai has one of the largest behavioral health units in South Florida. So Giselle, can you let us know a little bit about the services, how to access the behavioral health unit, and what the department programs entail?
Yes, thank you so much. First and foremost, thank you, Susan, for having us. We are thrilled to be here and to be sharing all of the information with everybody. And thanks to you and to Nami for having us here today. So in Mount Sinai, we do have inpatient and outpatient services. We have lots of services, actually. We have, like you said, we are a teaching hospital. We have many residents, students, doctors, physicians, psychologists ready to help out the community. In our inpatient unit, we have 55 beds.
That's a large unit.
It is a large unit. And we have 2 floors. So we're available for any emergency, needs. And if we do have our emergency department, we have a psychiatrist on call 24/7. We accept Baker Acts and voluntary admissions.
Wow.
So any patient that is in need of help, we are there available anytime needed.
So an individual who's feeling unwell or a family member can come to the emergency room at Mount Sinai and be evaluated by a psychiatrist.
That is correct.
That's really important. That's wonderful.
Yes, that is correct. Patients are obviously medically cleared, and then they are taken to the psychiatry area, and that's where they get evaluated by our on-call physician, and then they get either admitted to the hospital or they get sent back home with an appointment within 7 days in our outpatient office, which we have available in both the main campus and in the Hialeah satellites as well.
Okay, so you have a satellite in Hialeah.
Yes, we have several satellites all around Miami-Dade, but psychiatry right now is available in the main campus in Miami Beach and in the Hialeah satellites.
Wow.
We also offer our partial hospitalization program, which is something that many people don't know about, but it is a great tool. We love the program, the department. It's kind of like a stepping stone. Our patients really enjoy it. It's a program, and it's a day program, so patients are not there overnight, but we do keep track of them every day. We do see them every day. They come in, we have breakfast, we have lunch for them. They have group therapies. They see a doctor on a daily basis. So it's a great tool. They're not alone. They're not at home, and they're not necessarily admitted either.
Right.
But they do have daily assistance and help and support from our team.
That's really critical. I remember when my son became ill about a dozen years ago. He had a massive psychotic episode, which is what brought me into this work. The hospitalization was fine. He was not well on release. He was better. He was stable. And there was such a gap in the community as to what now. You know, when a young person in particular is interrupted, they cannot work, they cannot go back to school. What do they do to take that next step towards recovery? And so that's what a partial hospitalization program is, and I'm not aware of too many of those in our community. This is a really important piece of information.
Definitely. Like I said, we believe it's a stepping stone from the.
Right.
It could be both ways. It could be used both ways. The patient is in the office, and the psychiatrist might realize that the patient is unfortunately decompensating a little bit or is not feeling so well. They're going through a crisis. They're going through something very difficult. This partial hospitalization could be a stepping stone. It helps them because we see them daily. They can come in. They can express themselves on a daily basis, have support.
Have socialization with other patients.
Yes.
Really important.
And it helps them not reach that point of having to be hospitalized. And then on the other side, for patients that are hospitalized and do get discharged but are not ready to go home 100% because maybe they don't have that much support at home, they live alone, their family doesn't live with them directly, then the PHP is a great step down from the admission, because they can come back and see the staff, they can come back and see the doctors on a daily basis, but they don't have to stay overnight.
Excellent.
So it is one of our greatest achievements, I would say. We love our program, and we have individual psychotherapy in the center as well. We have our long-acting injectable clinic, which again, it's not very common in the area. It's very hard for patients to find a place where they can get these injections administered.
And this is antipsychotic drugs.
Correct.
That an individual needs, but instead of having to take a pill every day, and remember to do that, and also be reminded every day that they're sick.
Correct. Exactly.
They can go up to 90 days with these injectables, which is wonderful.
Yes. So we also have our autism clinic in our outpatient center. We have adult autism, where we provide internal medicine care and psychiatric care for these patients, as well as if they need to be admitted, they need to come in for emergency. We are obviously there available for them.
Fabulous.
And our Wayne Center for the Alzheimer's disease, where we also have a lot of support for family members and caregivers.
Thank you. This is amazing. Amazing resources. Really important to know. The community may not know that we've lost about 200 psychiatric beds in this community. 3 hospitals in our community have closed the doors on behavioral health at a time when behavioral health needs are increasing. And, we all have been bombarded by the popular media about the incidence of mental unwellness in all age groups now. And in fact, there was just a large longitudinal study about my age group, the baby boomers, and that we have the highest rate of suicide of any elderly, I hate to call myself elderly, any elderly group. Dr. Verzura, what do we look for? How do we identify warning signs? What are you seeing in your practice? And what are some protective factors?
Well, first off, thank you for having me. I wanted to add to something Giselle said, was that one key thing that Mount Sinai is special for is the fact that all the psychiatrists there are a family. There's about 7 of us, and we communicate to each other. If a patient goes into the ER and they're admitted in the hospital, they step down to PHP and they go outpatient. I mean, all of us are involved in the care, and somehow we rotate through these services, and the continuity of care and the communication is really what I think is golden about Mount Sinai staff.
Thank you for that. That's good.
Yeah, because it's important when, your child or someone's coming in, does this doctor know about what happened in the hospital? Does this doctor know what happened in outpatient? Does this doctor know how they were doing in PHP? And I think that the continuity and the communication is where I think I would trust my own family to go there as well. So, depression comes with different types of signs depending on the age group. Teenagers sometimes exhibit it a little differently than what the elderly do. Sometimes irritability and anger is a symptom of depression. I think the warning signs are also, isolation, low energy. Their grades are changing. I think that's a big one that people should look at, is what's going on with my child. Why is my child getting C's and D's now when they used to get A's and B's? I think that excessively sleeping or not sleeping at all, and isolating is probably a big warning sign. I think that the people who reach out or communicate with their parents and say what they're feeling, that gives me more hope as a provider to see that there is a good prognosis going on here versus somebody who's isolating. That scares me more. I think that it's important to bring these people in early because it's treatable. And that's the big thing, is that it is treatable with therapy, with psychopharmacology, medications that are appropriate to the symptoms, and with intervention. When it comes to the elderly population, there has been a lot of studies that we're now gearing towards early signs of Alzheimer's disease, neurodegenerative diseases such as Lewy bodies, dementia, frontotemporal dementia, that a lot of times the early signs are actually psychiatric symptoms we've noticed, especially depression. And not any kind of depression, because there's different ways, like sadness and apathy. But it's actually apathy, the one that is the biggest red flag, especially if an individual's never had depression before in their entire life, and then all of a sudden they're 65 years old and they don't want to get out of bed, or they don't want to go golfing like they used to. And I think that it's important that when someone is the age of 65 and older to think about, don't just think depression, think globally, okay, what is going on here? Could this also be a sign of memory decline? And that's what the Wien Center is known for, is early diagnosis. We get people of all different stages of memory loss. We evaluate, me and Dr. Dwar, who's a neurologist there and medical director. We do a neurocognitive evaluation, and we consider all types of reasons why somebody would present with depression and memory problems. It's not just, oh, you have Alzheimer's disease. It could be you're taking the wrong medications that are causing your memory. You aren't getting enough sleep. So we get different kinds of people. We get people who come in just wanting a baseline. The Wien Center is attached to a big, large research department, and we enroll people in studies who want to get further scans that may not be covered by insurance that can diagnose Alzheimer's disease. And we actually now incorporated skin biopsies there that are able to see if anybody has signs of Lewy bodies.
Really?
Mm-hmm. Yes, and
It's cutting edge.
yeah, definitely. We're on the brink of a cutting edge. Always, we're always trying to learn more about this. You know, the brain's very complex. So back to what I was saying is that people come in because they have a family history and they don't have any memory problems, and they still can get evaluated at the Wien Center.
Mm-hmm.
Some people come in because they're just having word finding difficulties. You know, some people come in because their loved one is depressed out of nowhere and they're concerned because they're forgetting to take their medications. So I just wanted to say that you don't have to reach a very severe stage to come into the Mount Sinai and get evaluated, especially at the Wien Center.
Well, you know, wellness checks for mental health are as important as wellness checks for physical health.
Right.
And we don't focus on that.
Right.
Enough. You know, I'm such a believer in early intervention. I know in the case of, you know, schizophrenia and psychosis, you know, first episode treatment has proved to allow people to get back to their lives.
Right.
And not be, you know, not have a life of dysfunction.
Right.
There's such a crossover between, and as we spoke, between mental health disorders that are untreated and memory disorders. There's something like a 4 times greater chance. Right. So what is that about, and what are some protective factors and interventions that we can successfully do?
So one of the things that would combat a little bit of stigma, I like to, you know, educate patients and families and people overall that the risk factor of dementia, the risk factor of Alzheimer's disease increases if you don't treat depression or anxiety, if you've lived your life with it. I mean, there's a lot of people who live in that gloomy state, and it's not good for their brain. It's not good for the blood flow. It's not good for all the neurotransmitters going on, and it actually can damage the brain and make it more vulnerable to neurodegeneration over time. And I find that people came to the center that have a history of bipolar disorder, and they treat it, and they have some memory problems, but they don't have a neurodegenerative disease. It doesn't mean that they have one. It could be just some concentration problems, and they've been treating it, and it's in remission. And then, you know, I haven't really seen a lot yet, okay, because I'm a little early in my career. So I haven't seen a lot of people coming in that have not treated their severe psychiatric disorder, let's say schizophrenia for one, like a chronic condition. I have not seen them, not many of them, to comment on that. But I do know that the research studies have shown that people who don't treat depression or any condition do in fact have an increased chance of getting Alzheimer's disease.
That's so interesting. And one of the things that as our population's aging, we're all, you know, the demographics are aging. Right. There seems to be a bias to accepting depression as a part of aging. Yeah. Well, they're old. What do you expect?
Right. And as also the fact that, they don't remember as much. That's because I'm getting old. Which is not the way it is seen nowadays. I mean, before I was even born,
not because I'm getting old.
Before I was even born, you know, looking back how, you know, the readings, how they evaluated Alzheimer's disease, they would come and they would diagnose clinically at moderate to severe stages.
Right.
You know, people at, you know, you hear my grandmother passed away at 90 years old, they had Alzheimer's disease. Well, age does increase the risk. And, you know, their grandmother might have had some memory problems at 70 or 80 and they were functioning fine, but they chalked it up to, they're just older. And of course, I have aging problems. But that's how it starts for, you know, no symptoms to some mild symptoms. And then it progresses. That's all the general theme of neurodegeneration.
Sure. So
But-
beware.
yeah,
Look,
be
look
aware,
at
yeah.
changes in behavior, or look at changes in
In memory,
energy,
right?
in memory.
And another thing is that this is actually a big misconception that people have, is that if I remember that I forgot, then it's fine. But a lot of people come in knowing they have memory problems when they're at a mild cognitive stage or mild cognitive impairment, and they address it early. And there's a lot to do to delay any progression if
Let's
it was.
talk about that.
Yeah.
Let's talk about intervention. I'm a big fan of prevention.
Right.
And I read Sanjay Gupta's book, Sharp Brain.
A Sharp Brain. I think
Sharp
I've heard
Brain,
of this, yes.
Fabulous book about
Okay, also
how
reading
to
that.
keep a healthy brain. Let's talk about prevention.
Yeah, so there is the studies have shown that let's start with diet, right? So anything that you're eating, okay, anything that is high in sodium, high in fat, high in carbohydrates, red meat, all of this is shown to impact memory, especially red meat. And sodium as well can cause brain inflammation over time. But it also, what it does is it exposes you to other chronic conditions like diabetes and heart disease, which the studies have shown, over time, we're starting to see things as an inflammatory response. Yes. So if you have a chronic condition, meaning long-term, like even sinus infections, chronic sinus infections, COPD, which is a chronic obstructive lung disease from smoking, heart disease. If you don't address those, and it's chronic inflammation over time that leads to chronic inflammation of the brain. So it's all connected.
Right.
And
which makes so much sense.
Right,
I mean,
right.
It's an organ, right?
Exactly. And they say that a Mediterranean diet, if you don't have any food allergies, fish, veggies are really a key to memory. And then we move on to probably the number one thing you can do in your life that everyone underestimates is exercise.
Yes.
But not just lifting weights. We're talking about aerobic exercise. 150 minutes. I read a study that said 150 minutes a week of aerobic activity can lower the chances of progression by 60%.
Wow.
Yes. So I've seen that. I can comment on a lot of patients that come in with, they on the scan, on their MRI, they have neurodegeneration and sometimes even severe neurodegeneration, but they're functioning well just because they are so physically active.
Right.
So
right.
there is a variety of expression of having, Alzheimer's
So bike
disease.
riding, tennis,
Right.
pickleball.
Swimming.
Everybody's crazy
Right.
about pickleball now.
Right.
Swimming, anything that gets the heart rate up a
Right,
little bit.
exactly.
Well, it makes it, just for a layman like myself, it makes so much sense
Right.
that when your circulatory system is active,
Right.
it's cleansing,
Right,
and,
exactly.
and keeping things open,
Mhm.
and that's so exercise, good
And
diet,
Socializing is a big one
socializing.
too.
Yes.
When the COVID pandemic hit, a lot of people who had Alzheimer's disease not showing any symptoms in the elderly population suddenly started declining after the COVID pandemic, but not from the disease, not from the virus, from the isolation, from the shutdown.
Mm-hmm.
And, time after, countless times I can say that I've had, daughters coming in with their mothers and saying suddenly they're not, wanting to get out of bed or wanting to do anything. They're having trouble remembering their medications, and they were fine before that. So
Yes.
socializing is very important.
And you made an important point: doing what you like.
Yes.
So if you don't like doing something, don't do it just
Right,
because it's in
exactly.
the book that it's.
Exactly.
But do something.
Exactly.
Stay
exactly.
active. Do something.
Right.
You mentioned daughters, and I did want to cover for a minute the resources you have for caregivers, because something like 60 or 70% of caregivers themselves suffer from depression. So how do you deal with the family unit?
Right.
I believe you have a caregiver support group. Of course, Nami has support groups for family members
Right.
as well.
So the Ween Center definitely addresses this. We have an excellent mental health counselor named Maria Ruiz.
She's wonderful.
She is absolutely wonderful. She works for the Ween Center, but she also volunteers her time in running groups outside of the Ween Center that you can attend. So you don't have to be a patient of the Ween Center. You don't have to have your father or mother being a patient of the Ween Center, or your spouse. If you've already connected with someone else, you can come to her caregiver group. She also has them on the phone. So for anyone who can't, location wise, you can contact her at the Ween Center. The phone number, if you want me to give the phone number out, is 305-674-2543. And you can ask for her. I spoke to her before coming here, and she's happy to answer anybody's questions, and tell her your schedule. Another way you actually can contact her also is at the Alzheimer's Association. I think it's als.org. She has all of her information there as well. We definitely address caregiver burden and distress, because Alzheimer's disease is a disease of the family. It's not just the patient.
Same thing with mental illness.
Right, exactly. And the dynamic in the family really does affect also not only the caregiver mental health, but it affects the progression too of the patient. So a lot of times I tell a daughter or a son who feels tremendous guilt and wants to be the primary caregiver, who have their own kids and their own I say, once you assume the role of a caregiver, you lose the role of being a daughter. So just remember that. And it's okay to bring someone in to help you as well. So we address the guilt as well.
That's really good advice.
Yeah.
So we have a couple minutes left, and this has been so informative. I'd just like to give you some time to cover some thoughts that you didn't have time to mention in terms of programs. We mentioned caregiving, PHP, really important, inpatient, outpatient, autism clinic.
Yes.
You mentioned to me that you accept virtually every insurance.
Yes, we accept Medicare, Medicaid. We accept all major insurances, United, Aetna.
You accept Medicaid too.
Yes.
Very important to know.
United, Aetna, Blue Cross Blue Shield. We accept all major insurances.
So there are no barriers to access.
Definitely.
For
we try to make it as easy as we
community.
can. We are available online. We also offer telemedicine appointments for those patients that cannot make it every day, in person. You can also schedule your own appointment online. We have our own MyChart application.
Great.
In which patients can go in, they can see other appointments, they can even write messages to the doctors directly, and the doctors answer within 24 hours. Patients love that.
You have
they
a great
love
website, by the way, that's very informative about the programs.
You can
It's
make your own appointments through the website as well.
msmc.org.
msmc.com.
Okay.
Yes. You can definitely find all of our physicians there. You can read up a little bit about them, request your own appointment, and we'll call you back with the availability, or you can actually schedule yourself in there through the system, and everything can be done via, nowadays technology is like the main thing online. So we try to make everything as easy as we can. And everybody is, ourselves are as available as we can to the community. So by all means, and like she was saying, some people may not necessarily know what kind of services they need or a family member may need. So feel free to call us, and, we will schedule an appointment. If we realize that you might need some help from Dr. Verzura in the Alzheimer's clinic, we can definitely make an appointment with her afterwards, a follow-up appointment. Like she said, we all work very, very close. So there is a lot of communication, and we will, we'll find the help you need.
This has been so informative.
We will guide you.
We will guide you, definitely.
Thank you.
Yes.
Dr. Verzura, you made so many good points today about diet, about early intervention. Was there anything else that you wanted to remind our viewers before we signed off?
Don't be afraid to reach out. fight the stigma that is
Thank
all
you.
the
Yes.
the misinformation on the media and the history, and just come in.
There's
It'll
no
be fine.
need to suffer alone.
There's no need to suffer.
And in that, I would just like to encourage everybody listening to and viewing this podcast to connect with us at NamiMiami.org. We have family support groups. We have peer support groups for individuals living with mental health conditions. We have a brand new program called the Peer Mentor Program, where we have family members and peers on office hours at our office to talk to individuals living with a mental health condition or their family members, and to connect directly. We have a suicide prevention program called QPR, Question, Persuade, and Refer. Whether it's your church, your school, your workplace, the hospital you work in, please bring our QPR program to you. It's a national evidence-based program, and suicide is on the rise among every age group and is really in crisis proportions. And everybody could intervene in the suicide with the right kind of training. I would direct everybody again to NamiMiami.org, to MSMC.com. And I would also like to take this moment to remind the community about two major developments that are really important. If you or a loved one are in crisis, you can dial 988, and it's in English and Spanish. You'll be able to speak to a trained mental health counselor, dispatcher, who can direct you to resources. We also have 4 new mobile units in Miami-Dade County, North, South, East, and West, that are being funded by the Thriving Mind, our managing entity. The dispatcher is a master's level clinician, and they will send a mobile unit to your home, your school, your workplace. These are clinicians, not police, and they will take an individual who needs help to wherever that individual wishes to go. So very, very important. And finally, I want to thank you for being here, for being a partner with NAMI, for the great information today. And I also want to thank the Florida Department of Children and Families and Thriving Mind South Florida for funding and providing support for NAMI Miami and its suicide intervention program. And I look forward to working with you.
Definitely.
Yes, thank you.
Thank you
for
so
having
much
us.
for being here.
Yes.
Thank you for giving us the opportunity to join you.